I'm Dr. Sam Spiron, a board-certified plastic surgeon in the Chicago area. Today we're going to talk about doctors. Sadly, incompetence in medicine has no age limit. This isn't something a lot of people want to talk about, but in our day-to-day work, us doctors have to be on top of our game. Some jobs require sophisticated cognitive skills as well as finely tuned motor skills. Some of these skills get worse with age, which leads to a question: when should your doctor retire? A lot of fields, like airline pilots, have mandatory retirement at the age of 65, but currently there's absolutely nothing like this in medicine. Should there be? This was practically unheard of when I was in my training. Back then, doctors routinely practiced into their 70s and 80s. They had nothing else going on except their jobs. And if you took that away from them, sadly, a lot of them passed away a few years after that. They had no other identity. This has changed nowadays with work-life balance being important to physicians. What does our plastic surgery society do to try to protect you, the consumer? Well, a few things. The American Society of Plastic Surgeons doesn't just have a strict code of ethics. To be board certified means very strict criteria, and recertification is required every 10 years, which recently has become every year. I don't have a problem with that. In this profession and in medicine in general, I've seen way too many doctors. They learn a certain way to do something and practice that for 30, 40 years until they retire. A lot of times they don't know about the latest approaches or look at the newest evidence-based studies, so they're not always giving patients the right options or all of the options. I really don't mind reading journals, researching the most up-to-date information, because I'm always trying to improve for my patients. I'm trying to get better with my technique, constantly assessing the newest cutting-edge technology. Why do I do this? Well, because I think my patients deserve it. That's what I would want out of my doctor. So in my personal opinion, incompetence has no age limit. It doesn't matter if you're 30 or 70. What matters is how physically fit you are, how sharp your mind is, how active you are, and if you can do your job to the best of your ability. There's so many variables. I've met many doctors throughout my years, and regardless of their age. Some are just terrible surgeons, some terrible people. Some have unbelievable egos and can't see past their own shadow. Some are so distracted by their home life, their personal situation, or their addictions that they are a significant liability at work, in the operating room, or in the hospital. Some people favor young doctors. They might have some more stamina compared to us older guys. I love working out personally, and guess what? The truth is, it was much easier for me to do marathons and triathlons when I was younger than it is now. But age doesn't always tell the whole story. There's more to it than age. There's bedside manner, technical skill, and experience, and these sometimes matter more. In fairness, you don't want someone who's just more experienced though. You want someone who's more passionate about their field. They're more up to date in their field. But with the same rationale, you don't want some of the cowboys out there that try to do every new technology and they think it's always the best thing in the world until they realize that it's not, and they stop doing it after a bunch of complications. Or when they realize that the drug reps aren't always the most honest and truthful about all the pros and cons of these new techniques and technologies when they're selling you something. There has to be a balance. I've been excited many times over my 24 years of private practice about a technology, and I waited years for some of them, only to realize when they finally were released to the public, they weren't really worth the wait. And by the way, just because a surgeon's hands have declined over the years and they've gotten a little bit older, it doesn't mean they should leave the field of medicine entirely. They still have value. If they can no longer perform complex surgical procedures safely, maybe they can continue to use their skill set to still benefit society, to train young fellow surgeons, and to help patients in other capacities. I don't think we should necessarily make someone retire at a strict age, and there shouldn't be a strict cutoff of 65 if they're still riding the peak of their career. I do, however, think that mandatory yearly testing is a good idea. We want to make sure that someone, whether it's me or someone else, can handle the profession. In fact, I welcome it. I welcome it with open arms. I don't have a problem going to renew my driver's license, getting a vision test every couple years. Why in the world would I have a problem with someone wanting to make sure that I was still a safe, competent, and effective surgeon? course I wouldn't have a problem with that. To be honest, I would worry about somebody that doesn't want to keep getting tested. Maybe they have something to hide. I hope you guys enjoyed this vlog. Please like and subscribe below and have a wonderful day.